Hey everybody, urinary problems in dementia are one of the most stressful challenges that caregivers can face, not just because of the accidents, but because families often don't know why it happens. It can be many things. Sometimes the cause is dementia, and sometimes it's mobility. Sometimes it's a hidden medical problem like the prostate or pelvic floor weakness, and that makes urination painful, incomplete, and urgent. So in this video, we'll talk about some of the hidden causes, gender-specific challenges, and environmental barriers so that you can protect their dignity and take care of them, keep them clean, and your loved one safe. My name is Matthew Estrad. I'm a gerontologist in St. Tammany Parish in Louisiana, and I've been partnering with the Council on Aging in St. Tammany for over 5 years, presenting videos like this that we call caregiver coffee discussions or conversations. So before we get into this topic of urination in older adults, especially with those who are experiencing dementia, just a little spiel that you probably heard me talk about with our caregiver support groups. You can find out more information by going to coastseniors.org, navigating over to the caregiver resources, and then you'll eventually find my picture. And then there's usually a link, or there will be a link to a flyer. That flyer has 2 months worth of dates and tells you where we are and when. But the basic format is that the first Tuesday of the month, I'm in Slidell at the Senior Activity Center in the evening. The second Tuesday of the month, we're on the virtual platform called Zoom. On the third Tuesday of the month, we're in Covington, where we are in person at the Senior Activity Center. And the fourth and sometimes fifth Tuesday of the month, we are back virtual. So this gives an opportunity for loved ones who cannot get out of the house and want to attend a support group. We offer that Zoom. And of course, some people can't even, they're not able to do Zoom because their loved one is with them. So being out of the house is also good for them. So we have all these different options that I hope you will check out. And once you find that flyer, you'll be able to sign up for the free email list, email reminder list, so that you can get an email every Tuesday morning as to where we are. I don't think I mentioned these are Tuesday evenings from 6 p.m. to 7:30 p.m. There's no need for a reservation. You just stop by. There's no commitment. There's never any cost because it's sponsored by the Council on Aging in St. Tammany. So I hope you will consider that. And if not our group, I hope that you're able to find a support group elsewhere because they are just so beneficial. The people tell us, and the science tells us, the research evidence tells us that. All right, let's jump into this topic on urination, urinary challenges in dementia, hidden causes, etc. This video draws upon some very good evidence, like all of our videos, and we'll have these sources named in the video description on YouTube. But we draw upon the Hartford Institute for Geriatric Nursing guidelines for incontinence management, the Alzheimer's Association 2025 dementia care practice recommendations, and clinical guidance from the National Institutes on Aging on toileting, hydrating, and skin protection. Additional evidence comes from the International Continence Society and the research by Schnelle and colleagues on prompted voiding. Medical context for prostate-related urinary symptoms is based on guidance from the American Urological Association on benign prostatic hyperplasia. Female-specific causes such as pelvic floor weakness and prolapse are informed by the American College of Obstetrics and Gynecologists. Product guidance includes quick change and PureWick external catheter systems. All right, so why are urinary problems? Why do they happen in dementia? There are a handful. Dementia can affect bladder awareness, timing, and decision making. People may forget where the bathroom is or how to get there. There might be mobility problems that make toileting more difficult. Medications, urinary tract infections, dehydration, and constipation worsen symptoms and can happen more often in old age and in dementia. And there could be hidden medical issues that we'll talk about, such as prostate enlargement in men. It can make urination incomplete and painful. So urinary problems is never laziness. It's a brain and body communication issue. All right, so let's like with many of these challenges, we want to start with the early warning signs so we can try to prevent these accidents. So in the behavioral area, look for these behavioral signs: fidgeting, pacing, pulling at clothing, trying to stand repeatedly, and searching for the bathroom. There can also be environmental signs. So what we're talking about here are poor environmental signs. These are physical features of the home that make it difficult to find, reach, or use the bathroom, and it can increase accidents even when the bladder is working fine. So here's an example. The bathroom is too far away. So these long distances increase urgency failures. Poor lighting, shadows, or dim hallways can make bathrooms hard to recognize. Cluttered pathways, so objects, of course. We've talked about safety in the home and having clear pathways. Well, if there's objects in the way, it can slow movement and increase urgency and can increase a fall, especially if you're rushing to the bathroom. A confusing layout, such as multiple identical doors and hallways, so making it difficult to identify this door as a bathroom because it looks like a bedroom door as well. Hard to open doors, such as round knobs, stiff handles, or locks that can confuse anybody. Cold or unwelcoming bathrooms that people avoid because they are uncomfortable, because they tend to be cold or have hard surfaces and things like that. And sometimes the bathroom isn't hard to reach, but it's hard to recognize, that we've talked about a little bit before. So what are some medical signs of challenges with urination? There could be a sudden increase in frequency and having to urinate, and that could, but not always, point to a urinary tract infection. You could sense a strong odor, which could be a sign of dehydration. There could be constipation, which could lead to bowel accidents later. Straining, dribbling, or discomfort is a possible prostate issue for men. All right, so let's expand into that. So for men, it's called benign prostatic hyperplasia, or BPH for short. And this is a benign or a non-malignant or a non-threatening enlargement of the prostate, but still not fun to have. So symptoms that caregivers may notice are a weak urine stream, a dribbling, feeling that they can't empty fully because it doesn't allow that, frequent nighttime urination, straining or discomfort, urinating small amounts but many times, sudden urgency with little output. So why does this matter with dementia? The person living with dementia, the person having the brain changes, may not be able to explain this discomfort that is happening, just constantly happens, and it's not goes undiagnosed, which and it means untreated because there are medications for this. They may avoid the bathroom because urination hurts. The incomplete emptying could mean more accidents later, and a higher risk of UTIs and bladder retention can happen. And sometimes sometimes the bladder is not the problem, it's the prostate. So it's important to identify that, to go to primary care and then maybe urology, but getting medications that can help to reduce. Now, typically these are daily medications that are taken for BPH. For women, while they don't have prostates, they do have gender-specific challenges later in age, and that one is pelvic floor weakness and prolapse. Symptoms that caregivers may notice are leakage when standing or walking, sudden urgency to urinate, difficulty reaching the bathroom in time, feeling of pressure or heaviness, accidents after coughing or laughing. So why does this matter in dementia? Well, they may not be able to recognize the urge early enough to go to the bathroom, to find the bathroom. Weak pelvic muscles make accidents more likely, and estrogen loss increases tissue fragility. So for women, the challenge is often muscle support, not awareness. So let's talk about a toileting routine that can prevent most accidents. Prompted avoiding schedule. So every 2 to 3 hours, guiding your loved one to the bathroom. Before and after key activities, going to the restroom. So before leaving home, before meals, I would say even after meals, before bedtime, and right after waking. So the schedule can help out. Environmental setup, a clear path, of course, to the bathroom, night lights. And I recommend night lights that are not if you can help it, not a bright white light like most are. So some can be, all different colors, blue, green, red, whatever is going to help and not wake up the person, like make them really alert. You just want them and you and they want to see. So that's night lights. Think about grab bars, a raised toilet seat, and contrasting colors. And by that, we mean a toilet that is a different color than the floor, or just have a different color floor, or you can get a different colored toilet seat that goes on top of the white porcelain, which can aid in distinguishing between the toilet, the top of the toilet, the seat, and a white porcelain floor, if that's what you have. So routine, and we've talked about routine, how powerful routine is in many things. So routine can reduce accidents more than anything. So let's talk about some gender specific products that can work. Now I'm going to give some brand names, but these are not ones that I have tested myself, but I have heard uh, some recommendations about one of them and that's one for men only. Is called quick change wraps. They're ideal for men to avoid when they're lying down. It's fast. It means fast nighttime changes, reduces skin exposure. They're also, and so those are the quick change wraps, and you can just Google that, look online, and see if that's something you want to try. There are male guards for light leakage. There are high capacity briefs with front padding and external condom catheters, as they're called, and it's but only with medical guidance. And there are also sort of external catheters that are called PureWick. That actually, I'll talk about that in a second. For women, high absorbency pull-ups with wider gussets, urinary specific pads, and adaptive underwear with side openings. All right, so let's get to what I was about to mention before, and it's PureWick external catheters. And I don't have any experience with these. I actually just looked them up today. These are non-invasive, suction-based systems that draw urine away from the body and they collect in a canister. So they basically have a tube that goes to a canister that would be on the ground or connected to the bed. It's a wick that rests against the area. There's a low pressure suction device that pulls urine into the tubing. It collects in a sealed canister, so no pads or briefs are needed. It reduces moisture, skin exposure, and nighttime accidents. It can be helpful for bed-bound individuals or those with mobility limits. And then I'll let you do more research on that if you are interested in that. I know it can get pricey because this is a device. It uses electricity. It's got suction. So keep that in mind. But there are things out there that you can try. So that's the good news. So I encourage you to check out those options from least expensive to higher costs. So for both men and women, you can consider overnight briefs, booster pads, waterproof mattress protectors, reusable bed pads, and adaptive clothing for easier changes. And that's possibly a whole nother video in itself. Adaptive clothing that use like magnets instead of hard to undo buttons. Both for pants, for pajamas, for shirts. There's lots of adaptive things out there where it might be difficult cognitively or just with dexterity, being able to undo buttons and things like that. So think Velcro, magnets, things like that. that can make removing clothing much faster. Skin protection and cleaning techniques. So we want to prevent skin breakdown. So there are things such as barrier creams. You want to pat dry and never rub because that could irritate the skin. There are no rinse cleansers, and there are also breathable briefs. For preventing rashes, it's recommended that you change the briefs or the underwear or whatever you have. Change as soon as possible. Keep the skin dry and avoid harsh soaps. So know when to call a doctor. Redness, when you see redness that spreads, when you see open sores, when you smell a strong odor, when you see signs of a urinary tract infection, or you see pain or straining in men, because this could be a possible prostate issue. So how can you talk about urinary problems without any kind of shame? Consider gentle language, such as these phrases, let's freshen up or let's stay comfortable. And I'm sure there's many others that you can think of. Avoid confrontation like blaming, arguing, or shaming. Of course, you wouldn't do that, but it's just, we want to say it just to be sure. We want to preserve dignity, and we do that by offering choices, maintaining privacy. If you're changing your loved one and they are embarrassed, even if you are changing them, because it could be an adult child changing their parent. Think about putting a towel around them or a sheet or something like that, so that you can help, but you're providing privacy, and you want to use a calm tone. So urinary challenges, especially in dementia, are common. They're manageable. They're nothing to be afraid of, but they can be difficult to get used to, and it just takes some practice and some guidance. And I encourage you to look up more things about how you can become proficient at this and become confident in it, so that you are able to engage in this challenge for maximum comfort for your loved one, for maximum comfort for you, and dignity for everyone as well. So I hope this was helpful. If you like this, check out all the videos that we have. Give us a thumbs up if you like it. Of course, if you feel like someone who could benefit from this information, go ahead and share it. We're not trying to get likes and clicks and views and all that, but if you think it's helpful, we want to encourage you to do that. So thanks for sticking around this whole time on this important topic, and I look forward to you joining us in a future video. Take care.